My name is Ayman. I'm the CEO of a social enterprise based in Egypt called Shamseya. We are an organization that is trying to figure out community-based, people-centered solutions for the different challenges facing the healthcare sector in Egypt and in the region. I graduated from medical school, and then before even graduating, I realized that I'm not interested in treating individual patients. I wanted to work on how the entire healthcare system is functioning and to fix the problems in it. Egypt has a very pluralistic healthcare system. We have public sector, private sector, civil society, tax-funded services, insurance-based resources. This is very problematic because in the end, the majority of healthcare spending comes from people's pockets, either because they don't trust in the services provided through the public sector or because they don't know that they are entitled to healthcare coverage. In Egypt, there has been a very limited amount of knowledge about how budget issues affect healthcare and how people can have a role when it comes to budget. The partnership with IBP has been crucial for us to be able to proceed with this work. It provided us with the knowledge and the capacities to engage when it comes to budget allocations in the healthcare sector, to see what experiences other countries around the world are carrying out, what works and what doesn't, and what can work in our context as well. In one of the civil society organizations we're working with, they had a problem with one hospital that was serving a population living within 200 kilometers, and it did not have a renal dialysis unit. So people with renal failure had to travel 3 times per week to get this renal dialysis. And so when we explained issues related to the budget and they began to realize how much money is allocated to this particular hospital, they said, we can use this as a leverage to push for the creation of renal dialysis unit in this hospital. So they had a meeting with the Member of Parliament. They made it very clear that they need this kind of resources to be allocated to that. The Member of Parliament took this information. He went to the decision makers at the Ministry of Health. And in a week's period, they had a renal dialysis unit in this hospital because of this change, because of this accountability. This is very empowering because on one hand, decision makers now have delivered something that meets people's expectations, so it increases the general satisfaction of this population from the government. On the other hand, civil society members have seen that this knowledge actually ends up delivering a value in their day-to-day lives. If our vision is fully realized, I think that citizen engagement and accountability would be an integral part of service provision. What keeps me motivated is seeing the impact that it's making and seeing how government officials are interacting in a different way with civil society, how they are seeing them as people that can actually support their work and not only cause them problems. I think seeing this difference, seeing this increasing readiness to invite and to involve civil society, this is pretty new, and for me is very motivating, and it's a very good sign that we're going in the right direction.